put on their conspiracy hats, their tinfoil hats, and say,
this is proof that medicine is broken. See, all you have to do is exercise and you're gonna be totally fine.
All right, guys, Dr. Goobie, the neurosurgeon who quit, a lot of the medical professionals, the residents, the attending doctors, even the med students, have a lot of interesting things to say on Reddit. So let's go through those comments. I think there's some truth here that the lay people are missing. And by the way, I found these threads several weeks ago, and now that I'm revisiting them, I can tell that several comments that were a little bit incisive, a little bit, polarizing, were deleted, but I'm gonna do my best to remember them and tell you what they said. Dude spent 9 years working long hours while making approximately $1 million. Now he has enough money to retire and focus on the bigger picture of life, not an uncommon story. It's a good point because neurosurgeons are the highest paid doctors of any specialty. They work the most insane hours, they work the hardest, they earn that paycheck. But commenter below him says he actually doesn't have enough to retire. According to the video, he says he doesn't even know what he's gonna do next, but he just knew he was dying inside and couldn't take it anymore. True, but when you're making close to $1 million per year, you now have hopefully a very large safety net and a good runway so that even if you don't make any money for several years, you're gonna be okay, even if you're not totally set for life. It sounds like he should have been a rural family doctor instead of a neurosurgeon or done a PEDS fellowship instead of spine. Very few of my patients have a disease process that they caused by poor lifestyle choices. And then the response, but he finds the spine fascinating with a $sign. That's something that so many people miss. He talked about how from the first day he graduated residency and was starting life as an attending, something felt off. And there was a comment from a neurosurgeon, which we'll probably get to, who said, if things feel off at the very beginning, something is definitely amiss. It's fine to feel off several years into your practice, but on day one, if things are off, something's amiss. And one thing that occurred to me when I was filming that video, but it was a very long video, couldn't get all of it in there. He chose spine, even though he was very interested in the brain-machine interface and maybe the stereotactic neurosurgery subspecialty would have been a better fit for him. But spine, what they tell you in med school, is that spine pays the best. And that's why a lot of ortho and a lot of neurosurgery residents, they want to go into spine because that cash money. Now, I hate the virtue signalers who say that money doesn't matter and you should never follow the money. Bull shit. There's a reason why there's a very, very high degree of correlation between how much a physician makes in a certain specialty or subspecialty and how competitive it is. And we actually have videos on the most and least competitive specialties. And guess what? Surprise, surprise, they track very closely with compensation. Actually, compensation and lifestyle, because if you're working really hard, it actually becomes less desirable. But again, we explained that in those other videos. But spine, the way that it's reimbursed when you're doing certain types of spine surgery is you get reimbursed on how many segments of the spine you work on. So you work on more spines, you can bill a much larger amount versus working on fewer segments of the spine. And I remember there were discussions back when I was in med school about how they're working to change reimbursement models so that it's no longer based on the number of vertebrae that you're working on, but I'm not sure if that's happened yet or not. Yo Dude 86, my neurosurgery attending was explaining how many more RVUs he gets, by the way, RVUs explained right up here, from spine surgeries versus brain surgeries that take about the same amount of time and effort. Indeed, I truly empathize with anyone suffering from burnout, and he's clearly very, very burned out, right? But I can't help but see this video as a prototypical example of pathological neurosurgeon ego. He goes on about how the medical system as a whole must be broken because his patients wouldn't require surgery if they changed their lifestyle. As if primary care docs don't spend half their day begging patients to eat better and exercise. It's just the most ego-driven conclusion one could come to. If my surgical skills can't help them, then the practice of medicine is entirely useless. Possibly a little bit harsh in the delivery, but you can't deny there's some truth to this comment. And unfortunately, so many lay people who are watching that original video put on their conspiracy hats, their tinfoil hats, and say,
this is proof that medicine is broken. See, all you have to do is exercise and you're gonna be totally fine.
There's a lot more to it than that. And you're gonna tell me that babies with congenital heart defects that would be lethal if not treated, all they have to do is work on their diet and exercise and everything's gonna be fine? Yeah, the average American has a terrible lifestyle and there are so many downstream consequences of that, and we explain all of that in our extremely thorough Peter Attia book summary with actionable steps. But I largely see this as the blame game, where people who are dissatisfied, who are cynical, who are unhappy for whatever reason, wanna point the finger and say the system is the problem, versus saying, hey, I could improve my own lifestyle. And even after improving my lifestyle and handling all these things, there's probably still room for medicine to help me. Or if I have a traumatic injury and need surgery. But of course, this is the internet and it's so much easier to just be cynical, have these snarky comments and pretend that you're intelligent when really you don't know shit. I watched the entirety of his video with my newfound copious free time the other day and was very curious what others in medicine and specifically neurosurgery thought. Personally, I thought despite his valid points, overall, he seemed quite burnt out. Yeah, of course. His apathy toward the value of his day-to-day work is a classic burnout symptom. This kind of stuff comes up on every year's ACGME survey. ACGME is the accrediting Council of Graduate Medical Education. They oversee all the residency programs. Not to say he is wrong to want a different life or that addressing disease as a risk factor level is wrong either. It just seems he lost sight of or became disinterested in the niche sector of health that neurosurgeons like him deal with. This is just burnout. He's an MD PhD with failed research goals turned to a spine surgeon. Not that there aren't slam dunk medical reasons to get spine surgery, but if you make a living operating on people with chronic lower back pain, I get the potential for burnout. His patient population is not the same as other people's. Lifestyle changes absolutely would have prevented issues for a large majority of that patient population. I think a lot of spine surgeons can get disillusioned once they realize how poor some of the indications for surgery are, and how mixed and poor their outcomes are too. Again, this is the thing that a lot of lay people are missing, and broad strokes, just as Dr. Goobie was implying that this is medicine and medicine is broken. No, dude, that's just one factor of medicine, not the whole thing. And ultimately, let's not sugarcoat this. It's his responsibility. He chose spine surgery, and rather than following his passion, and he was burnt out as a result. And he had all these issues, which again, are due to his decision. Again, I'm not anti-money. I just think that once you are a doctor, you're making good money. And what is much more important is how much you enjoy your day-to-day, how much you enjoy treating patients of whatever patient population, working on whatever pathologies, the types of procedures or operations or whatever you're working with. That is so much more important than making an extra $200,000 when you're already making $800,000. You see what I'm saying? The marginal utility of that 200K is far less than the utility of you actually enjoying your work. That's the issue. I second this in a way. Luckily, I'm not only doing spine, sounds like this guy's a neurosurgeon. But here's the thing, 95% of people presenting with first-time back pain can be managed by physiotherapy. And I tell them that. But almost 20% of them go for surgery outright, and 40% never stick to physiotherapy and lifestyle management, so it transforms to recurring. Yeah, man, it's tough. It's tough to get on top of your stuff and stretch regularly. I actually have a video on my whole stretching playlist because I got that lower back injury when I was 20 years old in college, right before starting med school. And I did that for years and years. And it was just a priority because it made my body feel better and it helped manage my back pain. And luckily now I've strengthened my body, I've worked on my mobility, and now I don't have to do that morning routine. But I get it. Doing the actual PT is tough. It's not convenient, but it's a lot better than the alternative, I promise. Good thing he didn't pick vascular surgery. I think the difference between back surgery and vascular surgery is that vascular surgery has good indications for operations. Also, part of the problem here is that American healthcare is more about the profits than about the actual health. It's like a form of alternative medicine practicing in the USA to make money. Some of those back surgeries are seen like sham surgeries. I like these comments that are getting to the gray area because there is definitely the argument to be made that healthcare in America is much more about profits than actual health. Why are we not diverting so many more resources to lifestyle, to exercise, nutrition, etc.? Yet we also acknowledge that there are truly valuable things that 21st century medicine provides us. It's not black and white. There is a gray area. Skull Bay, my advice 10 years out. So this guy looks like he's an attending as a surgical subspecialist in a tertiary academic center. Okay. My advice 10 years out is when you're starting out, everything's awesome, exciting, and fun. The hedonic treadmill is real. The better the surgeon you are, the more boring actual surgery is. Durability comes from the human interaction with patients, residents, colleagues, and researchers. In a separate thread, I got burned in research, but was invigorated by innovation and entrepreneurship and started a device company, but that's a whole other thing. So, for those who've been watching my channel for a while, you'll remember that when I was in residency, I noticed that very simple things. Actually, let's go back to med school. Knot tying in surgery and suturing was so exciting. I wanted to perfect this thing. I wanted to get better and better. And I saw this trajectory of my skill set improving. Right-handed knots, left-handed knots, one-handed, two-handed, how fast, how precise, how clean, all these things. It's a game to try to level up. And at a certain point, you keep leveling up, and then you start reaching an asymptote where you're not at the peak, but your level of improvement is really slowing down. And those things that were very challenging and exciting before are now becoming more routine because you're just way better at it. When I first started driving as a 16-year-old, I thought it was so exciting just to drive around the streets. But now I only get that thrill if I'm drifting my car on the racetrack. Now I remember in residency, soon before I made my decision, that something like suturing, which again was so exciting to me in med school, was now kind of boring and dull and kind of routine. Okay, cool, I know how to do this. And then I was helping my senior resident with half of a blepharoplasty, an eyelid procedure. And the eyelid, thinnest skin in your body. I think it's like, if I remember correctly, it's like 7 cells thick or some really crazy shit like that. And we're using our surgical loupes, those glasses that have little microscope telescopes on them. And the suture is like 6-0 or something really, really, really thin suture you can barely even see. And as I was suturing, I felt that rush again. I said, oh my God, there it is. I'm now understanding. You meet the challenge, there's excitement as you meet the challenge. As you start getting better and improving, first that's just suturing anything, suturing the most basic shit. And then that gets routine. So then you go to the next level. Now you're doing blepharoplasty, really thin, really challenging, and you get that excitement again. But eventually you do this 5, 10, 15, 20, 30 times. It's gonna get a little bit more routine, monotonous. And then the next thing is microsurgery, which was one of the things that I was very interested in, that and hand surgery. And then the level just keeps going up until you can't go up anymore. And now it's just routine. And I actually was speaking with a couple here in Vegas, a plastic surgeon, orthopedic surgeon couple, and they told me they will specifically go out of their way to do the really insane, complex, wild, sci-fi reconstructions that don't pay them very well because they want to feel that excitement again. Doing that mundane, boring shit, doing aesthetic plastic surgery, I mean, it was never my thing, but my impression of it is that, and again, I'm not a plastic surgeon, I was training in plastic surgery, but maybe an attending plastic surgeon would disagree with me on this, but my idea was always that there was something that was fun about the aesthetics and like the science of beauty and the art of beauty, but from a technical perspective, never even close to as challenging as doing something like a free flap transfer and these really complex, facial reanimation, microsurgical free tissue transfers. That stuff was a whole new level of technical challenge. And aesthetics, comparatively, it's still tough to do, don't get me wrong, but compared to that, way easier. So that's why I think this couple, the plastic surgeon and orthopedic surgeon, will both go out of their way to do the more challenging reconstructive things that are harder from a technical perspective, even though they pay a lot less. They want to feel something. Maybe I don't get some of his frustrations because I'm not a surgeon, but his complaint about healthy lifestyle putting surgeons out of work baffles me. Endocrinologists, cardiologists, and neurologists probably counsel patients on lifestyle modification at every visit. Are they not worried about being out of work because patients would live too healthy to get diabetes, MI, and strokes? MI is myocardial infarction, heart attack. Even if all patients follow these recommendations, the results of their honest efforts often vary, not to mention how few of them actually follow through. In my field, fixing the root cause for my patients sometimes means genetically editing every single cell in their body. No can do. I can only help with the downstream effects to make their life easier. I am at peace with that role. I look forward to doing that for my patients every day. Very well said. And again, strange that somehow spine surgery and some of the patterns that he notices there gets broadly applied to all of medicine where it's completely irrelevant. I watched the entire thing yesterday. I feel like I empathize with a lot of his feelings, but the reason he gave for quitting didn't really resonate with me. To see your profession as pointless because it doesn't address the root cause is kind of silly. You can't save everyone. Some people are just at the point in their life where it's too late to undo years of bad habits and you just need to treat what's in front of your face to help relieve some suffering. Yes, I agree, the country should do a better job of promoting health and awareness to prevent self-induced afflictions, and I agree, we have a massive problem with capitalistic greed influencing too many medical decisions. But at the end of the day, if his goal was to relieve suffering, he still could have done that as a neurosurgeon. I get the feeling he was just burnt out from the stress of his job because he realized after all that training, he wasn't a happier person. I completely get that because if you actually have an identity outside of your job, then you want to have the ability to experience that. Being stuck at the clinic or hospital all day or on call or dealing with patients can make you feel trapped if that's all you do. Most of us need a well-balanced life to stay sane. Well f***ing said, my guy or gal. I really feel for the guy because he's clearly extremely burnt out. But as you saw in the prior video, my original reaction video, and what I'm saying here as well, is that you should always be able to express yourself. But the issue arises when you are misinforming the public. You're pitting people against physicians because they believe that, like the number of people that tell me that doctors are just in bed with pharma and want to just push things to make money and don't care about patients' health. It's like, dude, you don't understand reality. Get your tinfoil hat off. Are there perverse incentives? Yes. Is money and big pharma an influence in healthcare? Yes. Is it black and white? No. I don't know, my dad, an anesthesiologist, has always talked shit about spine surgery. I never understood why until listening to that video. If most cases you don't actually make the patient better long-term, that would be a fast track to burnout. Now, I did a neurosurgery and orthopedic surgery rotation, actually a few rotations in ortho. And I remember seeing a lot of spine surgeries and being like, yeah, fuck that. I never want that to happen to me or my loved ones. It is very crude, very brutal. And I was like, yeah, PT for me all the f***ing way. MIT doesn't have a hospital or medical school, so I don't know how his MIT schooling has any bearing on his medical knowledge. But nice flex, bro. This guy has serious Gundry vibes. Strikes me as a little odd to title the video with your undergrad affiliation. We had a total loser soft science professor at my med school who would constantly mention his MIT undergrad liberal arts degree. It's an affliction. Okay, a bit harsh, but I mean, you gotta kind of milk the algorithm, I guess, and some people are a little bit more okay with pushing the boundary than others, and you guys have heard me talk about that many times on this channel, people being dishonest about their credentials, about what they're doing in life, what their degrees are, what they have done and haven't done. I ain't watching all that, but it sounds like a real wackadoodle. Healthy eating and exercise and social connection are all very important, and also won't prevent you from having any number of accidents or medical emergencies requiring surgical or medical care. It's amazing how some people become so smart. Yeah, again, I would say gray area here. It's, as a society, we definitely should be pushing more to lifestyle interventions. And I'm grateful for those who are doing their best to push that to the public, inform them. People like Dr. Rhonda Patrick and Andrew Huberman, who's definitely far from perfect and tends to reach a bit with his interpretations of the research when you actually look at it critically. Peter Attia and so on. These people who are making information that can very much improve your life much more accessible. I mean, even Brian Johnson, right? He has this crazy, wild, $2 million a year, something like that, longevity routine, don't die routine. And he even admits, he says, yeah, the overwhelming majority of it, I don't know whether it's 80% or 90%, whatever he says, in his opinion, some really high percentage is just the basic free shit. Your sleep habits, your diet, your nutrition. It's the free shit. It's not these crazy supplements and having a personal chef that's gonna prepare these meals for you and all that stuff. It's just that those things are boring. And no one wants to be told that because that's not exciting, that's not sexy. They wanna know what's the new supplement that they gotta take. What can they buy over the counter that's gonna boost their gains by 35%? And guess what? I'm gonna sound like a broken record, but your 3 pillars of sleep, nutrition, and exercise, if you focus on those 3 things, you are getting 95%. I keep repeating myself because it doesn't stick. It's not sexy. It's boring. It's like, yeah, okay, whatever, but I wanna know the other thing. Like, what's about that 5%? It doesn't matter what the 5% is when you're operating at 40% because your sleep, nutrition, and exercise are so out of whack. This video popped up on my YouTube feed, but I didn't watch it because the clickbait title bothered me. I'm also an MIT grad, but I would never describe myself as an MIT-trained gynecologic oncologist because MIT does not have a med school or hospital. Thanks for posting the AI summary though, that was a neat time saver. This MIT thing is getting a lot of hate. Sounds like he went into the wrong specialty. Data on spine surgery, not great. Seems he doesn't find it fulfilling and is frustrated about his choice for many reasons he listed. And in a similar vein, he seems like a man who's driven to fix problems, but went into one of the furthest possible fields away from that. Yeah, well said. All right, this PM&R doctor actually has a great response. I'm not gonna read the whole thing, but you can read it here yourself. And the final paragraphs here I think are worthwhile to highlight. The medical system doesn't have the best incentives to accomplish the ideal setup in my view, but patients also do not have the best resources or motivation to do this. It's unfortunately a double whammy. I think most non-surgeons try to do lifestyle interventions and have too many patients that can't do those things. It gets frustrating over time, and you end up recommending things that are short-term effective because you see so many people unable to make the lifestyle changes that will help them long-term. I'm glad he figured this out, but it's not revolutionary. Nearly all of us in physiatry, aka PM&R, pain medicine, and other conservative fields understand this. Most surgeons also understand this, but they can only do so much. Chronic pain patients are very challenging, and unfortunately, many of us have to start limiting them in our practices because they take so much effort and don't implement the changes we want them to make. There needs to be a change to insurance and incentives to prioritize conservative care and give patients the resources they need. Totally agree with that. I'm not sure how we did the patient motivation end of things, but unfortunately, that is likely more a byproduct of our society and not the medical system. Thank you. American culture, baby. What do you think? Comment below. See you next time.